Good afternoon. I'm Ken Melito, Workforce Solutions Manager for Chamberlain University. Welcome to this week's Mastermind Session, Serving Veterans Through Suicide Prevention and Healthcare. Today and every day, an average of 22 veterans, men and women who have served our country, die by suicide. Suicide is the 10th leading cause of death in the United States, claiming over 48,000 lives, 6,000 of which are veterans. This means that veterans account for nearly 13% of all suicide deaths in the United States while comprising less than 7% of our population. What's more disturbing is that this number is increasing. Our panel will discuss the ways we can reduce these numbers and the resources available to veterans and their loved ones to do so. Our panel is representative of efforts being made in the healthcare setting and by veterans themselves who know firsthand what it's like to contemplate suicide. Our panelists today are Dr. Shelley McDowell Porter. Shelley is a visiting professor for Chamberlain University College of Health Sciences Master's in Social Work program. Shelley has been a licensed clinical social worker for over 20 years. She received her Bachelor's of Social Work from Stony Brook University, Master's of Social Work from Fordham University, and her PhD from Howard University. In addition, Shelley also holds a Postmaster's Specialty Certificate in Psychoanalytic Psychotherapy from Harlem Institute in New York City, and also in Women's Studies and a professoriate certificate from Howard University and the University of Maryland, Baltimore County. Welcome and thanks for joining us, Shelley. That's quite the resume and a mouthful as well. We also have with us Dennis Edesso, who served in the United States Marine Corps from November 2000 to November 2005. Dennis enlisted in the United States Marine Corps in 2000 as a cryptologic linguist. Having also been trained in Arabic by the Corps, Dennis was stationed on the Iraq-Kuwait border in 2001, where he was used to translate at bridge checkpoints, patrol supporting humanitarian missions for medical personnel, and at enemy prisoner of war camps in the Anbar province. Dennis would go on to serve 2 more tours in Iraq in 2003 and 2004 before ending his time in service in 2005. Dennis, you've related to me that you really struggled when you returned from your last deployment. Can you begin by sharing your experience with us?
Yes. Thank you for having me.
Mm-hmm.
I was used at intricate bridge points, as you said, in some prisoner of war camps. I would translate at some of the towns, and the perils of war started to weigh down on me towards the end of my enlistment. There were certain images that I would see on the backs of my eyelids when I closed my eyes. One in particular is one that I'm now able to share. We were just outside of Nasiriyah, and there was just a firefight up ahead, and I came around the back of a striker, and there was a woman holding her lifeless 9-year-old girl who was completely covered in blood, and having to be able to understand what she was saying in Arabic, she was screaming out, my God, why my daughter?" Those were words that would ring in my ears as well. So over the 2 tours, there was just, more carnage, bigger bombs, louder explosions. Thankfully, I came home with all my limbs, and we came home with all my men. But some of us did succumb to some injuries, and later on, I lost a few brothers to suicide, just from the thoughts and the perils of war. I had an honorable discharge in 2005 and came home, married my high school sweetheart, and we welcomed our first daughter in 2006. And that's when a lot of it started to happen. I was finding myself just detaching myself from anything that loved me. I took a job in Baghdad because I needed to get back into the high stress environments. I operated a radar that was a constant target, so we were constantly getting rocketed or mortared. I did that for 4 years. I came home every 6 months for about 2 weeks, and it really started to take a toll on my marriage, and it took a toll on the relationship I had with my daughters. Around in 2014, when we were about to welcome our 3rd daughter, my wife finally told me, "Hey, it's us or this job." And fortunately, I picked my family. So I came home, and I still found myself finding jobs that would keep me away from my family. I worked on oil rigs that would keep me away for weeks at a time. Uh, when I was home, I wasn't really there. I could be the center of attention, the life of a party, and go into a bathroom and remove my mask and come down into tears. Just wasn't feeling like myself, and there was a lot of times I didn't even want to live anymore. I would recklessly drive my car with my headlights off, hoping to find an end. Making it look like it would just be an accident, knowing I was worth a couple million dead. My family would be well off, taken care of, and that white noise that was constantly going on in my ears would finally end. And my marriage was being held by a thread. And my wife finally told me, "Hey, you need to find some help, or we're over, we're done." And that's when I found this organization called Operation Restored Warrior, and my life started to change.
Thank you for sharing that. That was very powerful, and I can't suspect that was very easy to share either. So I appreciate that. Shelley, from your perspective, why do you think it is that? And Dennis may have really answered that question for us, but why do you think that the rate of veteran suicide is so much higher than it is in the general public?
Well, I just have to start off by saying thank you to Dennis. Each retelling is completely unique. It's similar for other veterans as well. I would definitely say it's difficult because at least the service members that I have met are very prideful. They're courageous. They're all things that is brave. And initially, when I started working with the military a few years back, there was a lot of stigma around admitting to having psychological health or mental health issues. But I think the military has done a lot better, and the community in itself has done a lot better in embracing stressors that happen after war, stressors that happen just for everyday life as well. But I definitely think that it was not typical to speak about. Everyone knew that it was happening to them, but because they didn't say it out loud, they didn't know how similar it was. And that's just my experience talking to the veterans that I have had the honor of working with, being a colleague to, and being a friend to as well.
Yeah. Dennis, where do you think that stigma comes from, that stigma regarding or surrounding mental health issues in the military?
From experience, there's a lot of veterans out there who are afraid of the repercussions of admitting that we do have problems. I know too many policemen that are afraid they're going to take their badge and gun away from them. I myself work for the government. I've held a clearance, and I was afraid myself to say, "Hey, I have some mental issues," and afraid it would take away my clearance, which was in turn my career. The biggest lie a veteran would ever tell you is, "I'm fine." I said it for 10 years. And now that I'm able to work with veterans, I'm learning that the two most powerful words that I've been able to tell veterans is "me too." When a veteran is going to tell me he's afraid, or he's filled with rage, or he has, everything, there's just stress going on. Hey man, me too. I cried watching Full House with my daughters once. And when I tell veterans that story, it brings them down to my level to say, hey, well, if Dennis is crying over Full House, I can tell him I cried watching a video with my daughters or kids.
Yeah, it makes you relatable, right? It builds that relationship, and I think you have that to share as a veteran yourself, right?
Correct. There's a little story about a veteran in a hole, and the veteran, a doctor walked by and threw some pills in the hole, and the doctor said, "Hey, take these." And although the veteran took them, he was still in a hole. And then a priest walked by and threw a Bible into the hole, and he said, "Read this." And the veteran read it, and although he read it, he was still in a hole. Then a major organization walked by and threw 25,000 keys to a truck into the hole, and although it helped, the veteran was still in a hole. Then a restored veteran walked by and jumped in the hole with him, and the guy was, "Oh my God, what are you doing? I've been stuck in this hole for so long. What are we going to do?" And the restored veteran smiled and looked at him and said, "Relax, brother. I've been here before. Now let's get out of this hole."
Yeah.
And that's really what my organization, Modus Deuce, is doing. We pull veterans out of holes, and we keep them out of holes.
And that's a great point. And for you, Shelley, you know, and I even as a veteran myself, I don't think that I can speak to a veteran and say, I know how you're feeling because I was never deployed. So how does the healthcare worker connect with the veteran in that manner?
I think that's an exceptional question because there's so much options now. While I am a clinician and I have trained and had the honor of working with the military for years, so I have that experience. For some veterans, there's nothing like talking to another vet like Dennis. And so the options are there. So sometimes rather than me being the primary therapist or clinician, I can partner with a dentist and other colleagues to say, okay, let's work on maybe your past trauma based on just your life history. But maybe for your history in the military specific, I have a buddy named Dennis, and there's a group that does A, B, and C. Would you be able to work with these individuals? So sometimes it takes a partnership, a community partnership. And I'm sure Dennis will talk a little bit about this too, because his organization does this in an outstanding way. But it's looking at the context of the individual, where they live, who they are, what communities they're in. Do you have religious affiliations, cultural practices? What is the diversity in you that makes you uniquely you? So perhaps it's also alternative services, like maybe you need a support animal. Maybe you prefer to fish. Maybe you prefer to hike. So mental health is not just a one-stop shop approach and you're drilling in like a Freudian approach. Let's talk about it. Maybe let's act it out. Let's go ahead and walk it out. Let's walk and talk. Let's ride horses. Let's learn how to shoot a bow and arrow. There's just so many different things, and you have to be practical about what that individual needs. And when you listen authentically, and don't try to, again, do a one-stop shop and just, this is what I learned in school, so this is what I'm going to apply to you. No, each person is a human, and they're an individual to be honored and treasured for who they are.
Absolutely. But on that last point, Shelley, do you think that that's adequately addressed in curriculum in master's programs in general, in social work programs rather in general?
I definitely think that they're getting there. I know a lot of programs, and including Chamberlain, who's developing a program right now specific to military trauma. We're looking at it much more, and we're incorporating trauma into all of our programs, especially master's level programs.
Excellent.
And we're taking real world scenarios, and we're doing events like this one so that we can get to know veterans in an authentic way, so that we're not just theorizing about what happens, but we're getting to know real people with real issues and concerns that they're sharing in their own voices.
Great, thank you. I believe it was Senator John McCain who first put the average at 22 veteran suicides per day. However, there seems to be some discrepancies there about the number. Does that matter, and why do you think that is, Dennis?
Everyone's going to kind of have different numbers. There's data out there, and sometimes data is just data. 22 is in our name, Modus Deuce. The name is derived from a 50 caliber machine gun. The Marines in the Army, we called it the Modus, the M2, and we incorporated that with the most scariest number in the veteran community is 22. 22 veterans a day commit suicide. And we do have events, and some people come up and like, well, I heard it's a lot lower now. The VA said it's 14, and this guy said it's 17. 22 is the stigma. One suicide a day is too many. But if we want to just call it what it is, 22 is the stigma. But unfortunately, there's a few states that don't recognize veteran suicide versus plain suicide. So if there was a suicide, it was just considered a suicide. If I'm drunk and I commit suicide, it's an alcohol-related incident in some points of data. If I am needing a high-stress environment because I am suffering from PTSD and I get on my motorcycle and drive 200 miles an hour and die, it's a vehicle accident. If you want to put in all those other scenarios, even ODing, we get hooked on pain pills, and when the VA cuts us off from not able to not have the pain in our bodies anymore, we turn to heroin and other types of pills that we can buy off the streets, and we can OD, and that's not a suicide, that's an overdose. When you want to incorporate that, the number could be even double the amount. So we don't usually get too hooked on the actual number. I mean, it's in our number, it's in our name, and our shtick. Like, we sell, all our shirts are $22. We have events where to register it's $22. The 22 is just to get out that number out there to make awareness of it.
I think that's important. Shelley, do you have any perspective on that?
I just want to say how much I agree with the scenario that Dennis gave. A lot of the work that I've done has been with the reserve population. And so the reserve population, when they're on duty doing that once a month drill, they are formally they're formally on task for everything. So if they commit suicide during that time while on drill or active duty, then they might count them into those numbers. Mm-hmm. However, after you're not on drill during the weekday or whatever, like Dennis said, if you are reacting from PTSD or any other stressors, anxiety, depression, and you have an alcohol problem, you are riding your motorcycle too far, you're getting into fights at bars, I mean, just a multitude of things, and you commit suicide, the military is not necessarily counting that as a military-related suicide. It just goes into the general population numbers. And so it's not adequately connected to the fact that the suicide might have had something to do with your military service. And so there, as in most statistics, there's underrepresentation and undercounting. And so that's a number that's not being counted there. So for me, that's the discrepancy that I have seen over the years. So I definitely think there's a significant possibility that it is significantly higher.
Yeah, and I, from what I've understood too, suicides in general are increasing, especially over the summer with all the stressors going involved with COVID-19. So I don't think it's really constructive to even really discuss numbers, other than use something like you said, Dennis. That 22 is something that's commonly understood. It can be incorporated in a lot of things that you do to simply raise awareness of the issue. As it turns out, September is World Suicide Prevention Month. So since we're discussing approaches to suicide prevention on different levels, what is being done, or what can we do further to work together to provide help to those who may be contemplating taking their lives? We have people working in a healthcare setting and someone on the front lines. How can you work together, and does that happen? Dennis?
So I loved how Shelley put it earlier. It's an individual approach. It really depends. There's a diagnosis that pills solve everything. I believe with my generation, I don't want to take pills to be the Dennis everyone knows and love. I need to find an outlet that makes me me. And my personal outlets is my faith. After going through Operation Restored Warrior, I established a better relationship with Jesus Christ, and it's been my ultimate outlet. When I am in my walk, I am my happiest. And there are times you step out of the blessings, and that's when, the attacks come, and that's when I'm not having the best of days. But I know now they're not my final days anymore. But my other outlets are, I love fishing. I've been scuba diving. I built a gym for vets in my garage. I have vets coming all the time, just working out. We hit some pads, we lift some iron, a couple little grunts, and, we have a protein shake afterwards. It's that the camaraderie is the catalyst, but it's really just finding an individual approach of what works for that veteran and making it happen.
Mm-hmm. And Shelley, how do we as healthcare workers come into that equation?
Um, I would definitely concur again with Dennis that it has to be an individual approach. I To intellectualize the human experience is not often the thing to do.
Hmm.
I definitely think if you need to be educated a bit more, that you look at some of the programs that the military put out. For example, the operational stress continuum model that the Navy first put out, then I think it was adopted by the Marines as well as the Army. It's a way of looking at stress and letting yourself know when you're overly stressed versus underly stressed. For example, if you're green, you're good to go. If you are orange, you're probably not doing well, and it has specific listing of things that you're experiencing. So are you having sleep issues? Are you arguing more with your family members or struggling at work? So looking at it not necessarily from a mental health perspective, but as a stressor as well, because beyond being a veteran, you're also a father, a mother, a brother, a sister. So you're all these things. So you're not only the military. So finding again that individual aspect of who are you, how can I help you? What are the symptoms that are not accurate for you? For example, maybe someone never slept more than 5 hours a day. So maybe sleep is not the issue for them. Maybe the issue is that they stopped watching a particular program with their family member, or they stopped going to church. So it's what's unique to that individual. And as clinicians or educators, it's the onus is on us to keep educating ourselves on whatever we think is applicable, not just the intellectualized theories, but what's on the ground, what's happening. I think the onus is also on us to go ahead and get to know more vets as our colleagues to ask, what can I do? What can I do better? So just not intellectualizing the experience, but being practical to what an individual needs, rather than what you think is theoretically appropriate.
Yeah, that's interesting, and it kind of brings me back to what Dennis is doing. Dennis, is it accurate to say that what you're actively doing really is I don't want to say distracting people, but having people in situations where you're removing those triggers? Does that make sense to you?
Yeah. So I want to first start off with PTSD is not prejudice. The scenarios and experiences that we have endured may have the same reactions to the triggers someone who was sexually assaulted or been in an accident or another traumatic event. So what works with other groups and scenarios also works with veterans. We've had great success with supporters of Ma Deuce Deuce come up to us and say, hey, this is part of my story, and they found the same relief from their daily burdens through just simply finding an outlet that works for them.
Thanks. I want to take this in just a slightly different direction as we start to wrap up today. As both a veteran myself and a person who has lost two family members to suicide, I can only describe my immediate reaction as anger. It seemed, and I don't know if this is right or fair to them, but it seemed as if my loved ones took all that grief and all those problems they were having and ended it for themselves. But I felt like they put it on all of us, their family members and their loved ones. What help is there for families, both preemptively and in coming to terms with loss of loved ones to suicide? Shelley?
I would definitely say again, there's so much different support resources out there right now, and especially because we're in a pandemic right now, there are so many online telehealth options that you have. Just like
Mhm.
everyone's viewing us right now, and they could see us all on screen, you have the opportunity to stay in your own home and be a part of a group, because I do think being a part of a group, a support group, lets you hear what others are feeling, and it normalizes how you're feeling, which could be an array of emotions. It could be anger, it could be sadness, but for some individuals, it could actually be joy as well. And so there's just all kind of emotions that are happening, and you don't know that until you speak to someone else. You can also take the individual approach of seeing a therapist one-on-one, if that is something that you want to do and explore those deeper feelings. But you have the option to see people face to face. You have an option to do online. You have an option to do groups. So there's so much things. And of course, there's lots of resources on the internet as well. Um, like there's a lot of resources on Facebook and other entities, even though honestly, Facebook is great as a supplement. I think that if you can get dedicated help, that means you are committed to getting support once a week, twice a week. So that is consistent, and then you can measure the changes in yourself. It's the best thing to do. And sometimes when we're working with social media, it's not always not that it's not accurate, but it, of course, is someone's individual experience. But sometimes different websites and different people promote what they want to promote as opposed to what's healthy for the person. So if you're going to get support, if you could get support from a reputable entity, um, that's the ideal circumstance. So that's for family members, that's for friends. And if you, sometimes you're the support to another individual, and sometimes it's overwhelming to hear because, as Dennis says, sometimes things replay in your mind, and you could get that through vicarious trauma too, because you're listening to all these things, and perhaps sometimes a family member feels guilty because they don't want to keep discussing the situation with another family member or a friend. That's when you need the help of a clinician. And so having that professional help, if you need it, it's definitely there. And if someone's worrying about how am I going to pay for it, systems are much better now. There's all kind of free services out there. There's also apps on your phone. There's mood apps. There's apps to check how you're feeling. They give you hints and tips and everything based on what you're saying, how you're feeling that day, because mood changes from day to day.
Yeah.
So I find those apps as a good supplement to talking with an individual or talking with a group.
Thank you. Dennis?
Unfortunately, I'm able to speak to a lot of veterans, and the biggest words that hurt when I hear them is they say, I just don't think I matter anymore. And I recently had this conversation with a very close brother of mine, and we were both sobbing on the phone because you could hear the pain in his voice, and he could hear the love coming out of mine. And I told him, hey man, you're hurting now, and if you were to do this, the pain doesn't end. Yeah, it ends for you, but it multiplies through all of us.
Right.
I could die tonight, and I'm gonna leave a couple hundred, maybe a couple thousand people upset that I took my life to my own in my own hands and succumb to my inner war. But nothing's ever worth that. There's nothing bigger that God, your brothers, your family, and your community can't handle. When it comes down to costs, if they need to get the help, there's organizations out there like mine who have paid for unmet needs. We have paid for flights for guys to get to Operation Restored Warrior, or we've paid for a rental car to get somewhere. We paid for the gas. There's help out there, and they just need to be able to put that left foot in front of the other and want to get help. We can't make these vets get help, and unfortunately, that some of them just expect it to happen overnight, and we still fail. Mm-hmm. We had a very important veteran commit suicide about a month into the COVID, and it was a big shock to us all, but it also woke us up more to try even harder.
Mm-hmm. Is that message that it does really transfer that pain to the loved ones? Is that strong enough, do you think?
I would hope so.
Yeah.
I know saying it, I know someone telling me that, and then I go and think about my wife and 3 daughters. those are the last 4 people I would ever want to disappoint or fail. And if those words don't resound to get the help that you need, what words will? What words are?
Well, that's a good point. Going back to something Shelley said earlier about Facebook and public, public platforms in general, we saw this week again how a veteran live streamed his suicide on a platform. Is there anything we can do about that, Shelley, or is there anything that we can do that, or are these platforms, are they liable for that in any way? Do you think?
Yeah, I definitely heard that this week, and I actually heard from my little cousin because she likes to, take a look, and the feed came up, and she watched it,
Oh
and she
no.
told,
Oh.
yeah, and she told me, oh, it was no big deal. And I told her, you know what? It's gonna become a big deal later. You won't notice it today, but you might be eating something, and it might become a big deal because you're gonna get a trigger.
Right.
And you're not going to know when that trigger is going to come. And I spoke with her about triggers, what they mean, what they might feel like, and what's good for her to do.
Mm-hmm.
And so I think that the media platforms, although I would love for them to have a little bit more control, I understand the politics of a hands-off approach, but I do think that they should make every possible commitment to making sure that they're constantly putting out awareness and providing maybe support numbers of support. This is where you go if you need this, if you need that type of support. Because I know that then, just like suicide, sometimes we don't know when our loved ones, colleagues, or friends are going to commit suicide because even though there's risk factors and red flags, it's different for everyone. And sometimes people genuinely don't know because suicide is such a personal decision. If someone comes to you and tells you that they're going to commit suicide, usually that's the cry for help.
Mm-hmm.
People who are going to commit suicide, they've already committed to it, and they're not necessarily going to tell you. And so I don't know to say that these different social media platforms can control this, but at least they can be proactive, and they could be solution focused about making sure that they spend as much time as they do on advertising, that they spend time putting out what resources are available so that the person who is watching or looking at these feeds is actually inundated as well by support and help. Mm-hmm. So maybe you're that person thinking of suicide at that moment, and hopefully one of these feeds pop up and you're like, you know what, let me call that resource today or go ahead to that resource. So I think that they should be more proactive about their commitment to awareness and putting out resources out there.
Yeah, I think you make a great point, Shelley. You as an academic and as a social worker who has experience in this field had the tools to talk to that young person about what they saw. But perhaps it is up to our social media platforms to put out information about how other people who don't know, can kind of handle that and talk to young people, especially who see that type of thing. Dennis, what are your thoughts on that?
I think it's kind of distasteful to sensationalize it. I think there's people sharing it right now to get the views and the comments and the shares, and quite frankly, I think it's disgusting. There's veterans out there that don't need that type of attention. I mean, if that was his objective, he did it. I don't know the whole story about it. I know he was fighting over a girlfriend, and the girlfriend called, and as soon as she hung up with him, that's when he did it. I will not watch it. I have enough images and smells in my brain that I don't need to add to it. But as far as being able to recognize this for loved ones, after 15 years of marriage, my wife has finally been able to start reading when I'm in that lower end of the cyclic emotions that I do go through. I have my highs and I have my lows, and most of the time I plateau in between. But when I am in that lower section, I create gaps and my wife is able now to bridge that gap. And it comes down to me just sitting at my computer at work when I'm working. I work from home. It's coming up, giving me a hug from behind and whispering in my ear that she loves me. Letting these veterans know that they do matter. They are noble. They are a good man. You are a good woman. I love you. I need you. Those are the most powerful things. I mean, I'm getting goosebumps right now because I'm just thinking about that when my wife says it to me. It pulls me out of it a lot faster. It's just a beautiful feeling. Those are some of the things that we could do.
That's interesting, Dennis, because in my experience, again, with my family's suicides, I think that both individuals really remove themselves from their families. So maybe if you're having those thoughts or ideas, bringing your family in, and I don't know how easy that is, but I think that would help. Wouldn't you say so?
Without a doubt, it's bridging that gap. There's a little commercial I want to make with a video. It's like a guy sitting around a fire contemplating suicide, and his phone rings, and it's a picture of another veteran, and he's like, "Hey man, what has tooth milkshakes isn't on his way over to your house right now?" And he smiles, and the commercial ends with these two guys sitting around a campfire now, drinking milkshakes. You never know when you could save someone's life by simply just, "Hey, I'm coming over with some milkshakes. Let's hang."
Yeah. Agreed. Last word, Shelley. What would you like to leave our viewers with?
Just to say, I guess to piggyback on what Dennis just ended with, when you ask someone how they're doing, really wait for the response. People ask how you're doing as good as you're saying hi or bye, but be prepared in your everyday life, not just in your professional capacity, but again, as a spouse, a friend, a colleague, to say, how are you feeling? And actually wait for a response and know that sometimes the response is going to be not too well. And then, putting in the time and the effort to say why and how can I help? Because those words mean so much to people. And if you can afford to say something positive each day, I know it seems cliche, but you don't know how much you've made somebody's day. Maybe it's a colleague at work, whether the individual is a veteran or not, and someone has done something really well. You don't know what they're facing, the challenges that they're facing at home. And perhaps they're not blessed like we are with family members or with support systems. But just to say, hey, you did a good job. How did you do that? So engaging people in conversations that they can feel positive about themselves. It costs nothing to spend a couple of minutes to do that. And sometimes you've really made a difference for someone. So I would say authentically ask how someone's doing and wait for a response and be prepared that sometimes it's not always going to be, I'm okay, I'm fine, and to listen.
Right. Or maybe even asking again. That's a great point, Shelley. We do use that as a greeting, and I don't think we're always interested in hearing the answer. It's just kind of like saying hi, right? So maybe we can all make a greater effort to, when we ask how you're doing, to listen to that response. And even if they say, oh, fine, but you pick something up, maybe asking again, hey, how you doing? Right? I mean, really kind of digging down a little deeper. I think maybe we could help some of our friends out this way, or loved ones, or even strangers. Dennis, I'd like to hear some of your last words, but also I want you to put in a little plug for Ma Deuce Deuce. I think you guys are doing some great work there, so I definitely want to get the word out about that.
Awesome. So I would say don't be afraid to be a little vulnerable. There's parts of your story that you may not be too proud of or afraid to share, or sometimes too painful. And I've had several times where I have shared parts of my past, even before the war. We all have wounds that are in our hearts well before the most traumatic events that we've experienced. The war was kind of just the straw that broke the camel's back for me. And I've shared parts of this story with other vets, and it's totally opened up a whole nother avenue of recovery for them. So don't be afraid to be vulnerable. Sometimes your deepest scariest moments can actually be saving a life of another person. As far as Ma Deuce Deuce, we are consistently having events now, hopefully, with COVID winding down. We have a huge event coming up right now. It's called Operation Rucket. It's a 22-kilometer ruck that we're going to be doing. We usually do down the Jersey Shore. Last year, we had almost 500 people walk with us. This year, we're doing it virtually. So we have, I want to say roughly right now, 35 teams across the United States. We have a team in Afghanistan. We have a team in Hawaii. We have a team forming up in Colorado that I know of. And we're already over $15,000 raised for the foundation to keep the mission going. They can find us on ma22.org or search Ma Deuce Deuce, MADEUCE on Facebook, and you can see parts of my story, other vets' stories, and other organizations that we have affiliated with since we began.
Thank you very much, Dennis, and thank you, Shelley. You guys are doing such great work to help people out through this. And to my panelists and all our viewers, thank you very much for joining me today on this discussion topic. I learned a lot, and I hope you did too. We'll have some information at the end of this broadcast about different numbers you can reach out to for help and different websites. However, if you're contemplating suicide, please reach out to any of the avenues out there available that we were discussed today, or some of the others that you can find on the internet. The National Suicide Prevention Lifeline number is 1-800-273-8255. Thanks again for joining us, and have a great day.
Thank you.